This is the arthrokinematic restoration system for the patellofemoral joint. When we are repetitively moving in that forward direction, we are required to go through a bend in the knee. That bend is going to require the patella to glide inferior and medially. So that is going to be that C-shaped movement of the kneecap, or the patella is going to glide inferior and medial. Those are going to be the glides that we restore. I will use 3 different tools for this. I'm going to use a double lacrosse ball, a single lacrosse ball, and a foam roller. I want to be able to bend the knee and get the patella to glide downward. So I'm going to release the muscles that are going to hinder that glide. The first one is going to be the tensor fasciae lata. So to release the tensor fasciae lata, I want to find my ASIS, and then I'm going to find my trochanter. So between my ASIS and trochanter, I'm going to have that line, and then I'm going to go right on in the middle portion of that. So that is where the single lacrosse ball is going to go. I will then lie on my side with pressure into that area. My top leg, I'm going to use kind of as a balancing leg, and it's going to go in front. And the leg that I'm releasing the tensor fascia, I will bend that knee, and then I'm going to rotate it towards the floor and up towards the ceiling. So I will rotate back and forth to release the tensor fascia lata. I will spend 2 minutes on the tensor fascia and then work my way down into the quadricep and the IT band. So the IT band, the anterior portion of that, will prevent the knee from bending, and it is going to also prevent that medial glide of the patella. So I'm going to get my foam roller, and I'll go right into the release of the quads and the IT band after I release the tensor fascia. So I'm just going to go from the very top of the hip all the way to just above the knee, but not over the knee, and slowly investigate areas of tension or tenderness there to get a mobilized effectiveness. I can bend my knee and straighten on areas that are tense or tender. And then I can turn onto my side, resting one leg and angling slightly downward to get the tissue between the vastus lateralis and that anterior portion of the IT band. There's usually a lot of adhesions in that area, and it can be tender. That is going to be the release of the quadricep and the anterior portion of the iliotibial tract, the IT band. To further allow better flexibility in the knee band is going to be the anterior tibialis, or the fascia on the lower outside part of the leg. So this gets into the anatomy trains. And if we want the knee to bend more freely and fluidly, this fascia is a link to getting the knee to bend better and commonly overlooked. To do that, I'm going to go similarly to the position we did with the foot. I'm going to place the double lacrosse ball on the outside lower part of the shin and just work my way down along the anterior tibialis, or the fascia on the front lower part of the leg, but staying on the meat of the tissue. And here I am just investigating and going slowly. And then where there's most tension, tenderness, spending 2 minutes there to do the release there. That is going to be the releases: the tensor fascia lata, the anterior portion of the IT band, the quadriceps, and the anterior tibialis, or the fascia of the lower part of the leg. Then what I want to do is, if I am not able to do the combined tensor fascia and quad stretch, which is my preference, but it can be intense to start with. So this is going to be the combined stretch, holding 3 times 1 minute. You want to make sure that the knee is on a soft surface and that you're forward enough that your quad tendon is on the floor and not putting pressure on the kneecap. If that is too difficult, You can do different versions of that same stretch, or you can stretch the quadricep and start with that stretch. So the release, that's the stretch. Then the strengthening is going to be isometric, hamstring and quads. And I will do that also with an inferior glide to the kneecap or the patella. You want a heavy band for this. I'm going to use this band that's got a lot more tension on it. And you can just do a wall sit without using this, but it just adds a little bit of inferior glide doing this. So go into a wall sit, hold for 1 minute, come out, go back in, do 3 times 1 minute wall sits. You're gonna get strengthening in the quads, the hamstrings, and getting that inferior glide on the kneecap or the patella. If you're going to want to do both, you can do the resistance on both or one at a time. But if I'm having trouble with my patellofemoral joint on my left side, I will put the heavy band to encourage that inferior glide and hold that position. That completes the arthrokinematic restoration system for the patellofemoral joint.